Welcome to the September issue of the Arthroscopy Journal. I'm Dr. Claude Miller, one of the associate editors. This month's issue has a particularly diverse group of topics. Doctors Alexander Lederman and Stephen Burkhardt achieved good function in a series of 9 young patients in which they revised displaced greater tuberosity and proximal humerus malunions by arthroscopically excising the displaced tuberosity and retensioning the rotator cuff arthroscopically. Doctors Andre Wyman and Wolf Peterson concluded from a cadaver study that reconstruction of the posterior oblique ligament significantly improved stability in complex posterior cruciate ligament injuries over isolated posterior cruciate ligament reconstruction. Reconstruction of the medial collateral ligament did not have any additional effect on posterior stability. Dr. Joel Ferrero showed in a cadaver study that tunnels drilled in the center of the coracoid at the time of AC joint reconstruction had a significantly lower risk of coracoid fracture than eccentrically drilled tunnels. Doctors Nathan Mall and Nikhil Verma performed a meta-analysis of subscapularis repairs and documented good overall results. There was no clear-cut advantage to arthroscopic versus open repairs. Doctors James Worthen and James Lubowitz performed a meta-analysis of the Level 1 studies on surgical procedures for articular cartilage injury. They discussed the significant systemic problems, protocol variability, study limitations, and potential bias of the 10 prospective randomized studies. They concluded that because of these factors, there is insufficient Level 1 evidence to support any single surgical procedure over the others. Dr. Mark Philippon studied arthroscopic treatment of FAI in patients 11 to 16 years and concluded that it was generally safe and effective, although there was a significant incidence of second procedure for adhesions. Dr. Alan Barber showed that a double-row bridge construct with tape was stronger at time 0 than a single-row triple-loaded anchor construct. Dr. Anastasio Georgoulis found that ACL reconstructions with a bone patella tendon bone graft caused the development of a hamstring dominance in the operative extremity. However, while there were good controls, there was no hamstring tendon grafts to determine if the same thing happened when the hamstrings are used as a graft. Dr. Stephen Burkhardt repaired massive rotator cuffs arthroscopically in individuals with pseudoparalysis. He found that if there had been no previous attempt at surgical repair, good results can be expected in 90% of the patients. However, if a previous repair has been attempted, less than 50% will retain good strength and motion. Dr. Paolo De Benedetto showed in a cadaver study without any clinical results that computer navigation is more accurate in inserting mosaic plastic plugs compared to hand insertion of the plugs. I hope you enjoyed this month's issue. Thank you very much for your time.